Alright, hi, my name is Daniel. So we've already gone over the subjective portion, kind of gotten all the info we need. I'm going to go ahead and write out what we're going to be doing, all the different tests and things. So if you want to just hang out here for a second, I'll get through that. And we'll get into our tests and we'll get rolling with that. Okay, sound good? I think we're ready to go. So my three working hypotheses are lumbar disc disorder, lumbar degenerative joint disease or facet syndrome, or lumbar instability. So we're just going to get into a few things, a quick observations of some different things. I'll walk you through it, and then some special tests. And hopefully by the end, actually definitely by the end, we'll get you through some things that'll help you feeling better, some things you can kind of take home and work on. Okay. So the first one, I'm just going to observe your posture. So if you wouldn't mind just standing up for me. Perfect. And would you mind just raising your shirt up just a little bit so I can see your hips? Perfect. That's great. Slight lumbar lordosis. Okay, awesome. And then I know we're really cramped on room, but I'm just going to see how you walk. So in this space, I'll just have you walk in a straight line back and forth, two or three, like 2 times. Okay, just kind of to the camera and back. Okay. Good. And one more time. Awesome. Go ahead and take a seat for me. So you said anything when you're kind of going into this motion is hurting. Just want to assess that kind of. You're talking about the cobra pose a little bit. So I'm going to have you go ahead and lay down face first where this towel is. And then kind of go into that motion that is kind of hurting a little bit. Okay, you have pain with that right now? Okay, where does it hurt exactly?
On my left lower side.
Left lower side,
yeah.
Okay. Would you mind laying down and kind of taking your hand and pointing to where that hurts? Right about there. Okay, perfect, awesome. Go ahead and sit up for me. Perfect. Okay. We're just gonna get through our a quick neuro screen, make sure all that's good, and then I'll get into some palpation as well. So I'm just going to be taking this cotton ball and be touching it on either your right or left side. Okay, I'm gonna have you close your eyes. This will be on your legs. I just want you to tell me if it feels the same or different. Would you mind being able to take your socks off for a second? Awesome, thank you. Okay, go ahead and close your eyes.
Same. 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 Same.
Okay, perfect. All right. Why don't we go ahead and, so I'm going to have you raise your knee up as far as possible, okay? Just with your knee bent, just kind of like this. That's high off the table. Okay, and go ahead and don't let me push your knee down. Same thing with this side. Good, far down on both those. Okay. Go ahead and lay down on your stomach once again. I'm going to have you just keep your leg straight. I'm going to have you kick your leg up towards the sky, kind of towards my hand for me. Good. Go ahead and resist. Don't let me push it down. Good. Same thing with this side. Good. And then I'll have you roll into your side, kind of facing me. Same thing, I'm going to have you keep your leg straight and come into my hand with it. Go ahead and resist. Good. And I'll have you flip on over to the other side and we'll do the same thing for the other leg. Okay. And resist. Good. 5 more of those. Perfect. I'll have you lay back down on your face for me. I'm just going to do a couple CPAs and UPAs. Let me know if anything feels tender or painful, or if anything feels better, okay? 05.
It's a little tender right there.
Okay, on the right or left side or everywhere?
Left side.
Left side, okay. Let me know if it's too much, okay?
Mm-hmm.
Okay, so just tender on that left side towards the lower portion?
Yes.
Okay. Did that pressure feel good? Did it alleviate symptoms or did it kind of re-induce it, kind of more painful?
A little more painful.
A little more painful. Okay, perfect. Awesome. You can go ahead and sit up whenever you're ready. Alrighty. Perfect. Perfect. So MMT's 4 out of 5 with hip extension or hip flexion. 5s on everything else. That's great. All right. I think we're ready to move on to our special test. Real quick, I'm gonna have you stand up for me. And I know you said kind of extending your backwards like that. I'm gonna have you take your hands kind of like an old man pose, and I want you to go into extension like this. We'll do that for quite a few, 5 or 6 times. Yep. Any pain with that?
Slight.
Slight pain, some tenderness, okay? One more. Kind of the same level of pain, or is it increasing or decreasing? Okay. Perfect. Awesome. Okay. You can go ahead and stay standing for me. We're gonna do the quadrant test now. So I'm just gonna be rotating your back and extending it. We're gonna start with this side, and then we'll move to the side that's we're kind of more focusing on. Okay. Good. Okay. So I'm gonna have you turn this way. And here. Any pain with that?
No.
That?
No.
And with that?
No.
Okay, perfect. We'll do the same thing with this one. Pain with that?
Yeah.
A little bit with that?
Yeah.
Okay. Pain with that?
Yes.
Okay, I'm not going to push past that next level. Okay. Kind of in that same spot?
Yeah.
Okay, perfect. Okay. Awesome. Okay, and then the last one is we'll do Gower sign since you're standing already, or since you're standing. I'm just going to have you come over, try to reach down and grab your feet as far as you can. Good, and I'll have you stand back up. Good, we'll do that again. And stand back up. And one last time. And stand back up. Perfect. Okay, awesome. Go ahead and take a seat. Perfect. So Gower sign would be negative, looking to see how they're standing up, how they are coming out of that flexion. See if they're using their hands to get up or if they're using their hips. The quadrant test is just a check for the closing down of those facets to see if there's any reproductive symptoms, which there was, and that would be a positive test. And then the CPAs and UPAs are just looking for pain, reproduction of symptoms, which we did have a little bit on the left UPA. So we'll go ahead and get into our next few. All right, I'm gonna have you go ahead and lay down on your back. I'll get this towel out of your way. Okay, we're just gonna do a straight leg test. Since starting on the left, correct? Okay, we're gonna start on the right. Okay, just go ahead and stay relaxed. I'm gonna put you into full extension. Let me know if there's any reproduction of pain or it starts hurting. How does that feel? Okay? Okay. Tight there. Okay. Same thing with this side. How's that feel? Okay. Tight there as well. Perfect. So negative on that. Just looking to centralize pain into the lumbar spine. No increase in pain with that. Okay. All right. So we've completed that. Okay, we're gonna go into abdominal performance. So I'm gonna have you bring both of your feet. Kind of bring your knees up and both of the feet on the table. Perfect. I'm just gonna have you take your right knee and lift it up in the air, just off the ground. Perfect. I'm just, let me set it back down. I'm just gonna lift your shirt just here. Is that okay? Same thing with this one. Back up to there. Perfect. Okay. Level 1 would be a pass. Okay. And then I'm gonna have you lift this knee up one more time. And I'm gonna have you slide your foot down the table. And back up. Okay, and bring that back down. Okay, same thing, bring this one up, and then slide that one down the table. Okay, and back up. Okay, and you can bring that back down. Level 2 would be a pass. Okay, and then I'll have you bring this knee up again, and then instead of sliding it, I just want you to hover it kind of right over that table, okay? Okay, and back up. Okay, and we'll switch sides. Back up, and then slide that hovering. Perfect. Okay. And so level 3, we did have some raise in our lumbar, so I'm just going to kind of cue that. So we're going to raise this one back up, press down. I want you to hover that one more time. Good. Is that difficult at all?
No.
No? Okay, we'll do the other side. One more time. Raise this up, yep, and hover that side. Good. Okay, so we will be working on improving level 3, as that is where we started to have lift off. Okay. All right, the next one we're going to do our bent knee fallout test. So I'm just going to have you straighten this leg all the way, and I want you to try to bring your knee as far out this way while keeping your foot there. Okay. Good, and back up. Go ahead and do some support. Go ahead and do that again. Good, back up. Okay. Have you switched legs now? Perfect, and bring that all the way out as far as you can. Slight raise there, okay. And then one more time, I'll have you bring it back up. Good, and back up. Okay, so it'll be a negative test. Not really a whole lot of hip hiking with that, but stabilization did help. Okay. So just a little recap. This is for the camera. You're good. We had a positive test in the quadrant test, slight positive test in UPAs on the left side, negative test with CPAs, as well as negative test with the single leg raise, and slight reproduction symptoms on the repeated extension. We had a negative Gowers sign, a abdominal performance test of getting to level 2, and a bent knee fallout negative test as well. We're stressing the stability of the abdominal muscles as well as the obliques, which are part of the abdominal muscles, during all of those lumbar instability tests. So stressing it with the Gowers sign, with the bent knee fallout, as well as the lower abdominal strength and coordination test. And then I think we have talked about everything that's been stressed with all tests. So I'll have you guys go ahead and sit up for me. I'm going to take a minute or two just to put in my notes so we can get into some treatment and hopefully get you feeling better. All right, I think we're good to go. Real quick before I talk to the camera, we're just going to reassess your asterisk sign. To recap, the asterisk sign is that scorpion pose going into back extension, and there were no red flags in subjective, as well as no red flags that came up in the objective. So I'll go ahead and have you lay back down. Let me get this towel in front of your face. Make it a little bit more comfortable. Perfect. I just want you to do that same extension. Yeah. Perfect. How would you say that pain is compared to when we first started?
It feels more loose.
More loose? Okay. Better feeling? Worse feeling? The same? Better? Okay. Perfect. Awesome. Go ahead and sit up. Okay. So I'm going to walk you through some exercises that you can do at home, as well as things that we'll do here. And then we'll end it off with those UPAs that we're talking about that we did. Did you feel like that those UPAs were helpful, that they alleviated the pain, or did you feel like they made them worse?
Helpful.
Okay. We're going to start pretty light with those today at the end. But first we're just going to go through a couple exercises. The hypothesis that is ruled in is lumbar disc disorder with a positive quadrant test and a positive UPA test, which can also come with some abdominal performance. So basically what all that means is we've got some things in our back that are kind of flared up. It could be from doing something new, things like that. We really want to get that flare going down, and we want to strengthen all of the muscles kind of around that wall to kind of help and hold and brace that, okay? So we're going to alleviate the pain in your back with those pressing motions that we did. At the same time, we're going to strengthen all the muscles around it so that we can keep it from happening again and just make you stronger overall, okay? So the first one we're gonna do is called the quadruped arm raise. So I'll have you hop off the table. I'm just gonna kind of show you how to do it, and I'll have you do it. So you're just gonna be hands and knees like this, and you're gonna bring right arm up first and left leg back, all like this. And I just want you to think about keeping a really tight core as you do it. And then we'll come back down and switch sides. Okay? I'm gonna have you do one side then the other for 1 rep, and that we'll go for 10 reps total. So 10 reps each side. I just want you to practice keeping a tight core and even a tight back. Just really kind of controlling that motion going through 10 each side, okay? Let's try to get your back up just a little bit so it doesn't sink so much. Perfect, much better. Good, and I'll just have you switch sides each time you come back down, okay? Good work. Great control. Make sure you keep those abdominals tight and don't let your back sink down. Good. Good. Last one of each side. Perfect. Awesome. Go ahead and take a break. And go ahead and sit down. How are you feeling after that? Was that difficult at all?
A little.
Okay. Was there any pain with that? Okay.
Not too much.
I mean, it's not the most comfortable thing, obviously, going into a little bit of extension, but we really need to strengthen those lumbar extensors as well. So we don't want to push past any bad pain, but exercise can be a little bit tough sometimes. So next one is going to be for the abdominals up here. So I'll have you stand up just so I can kind of show you this one again. So you're going to be laying on your back, and I almost like to think of this as the exact opposite. So we're going to be just like this, and then whichever leg goes down, the other arm goes up. Just like this, back to here, just like this, back to here. Okay, we're just thinking about keeping tight core in general. So not just the abs, but the back as well, keeping a nice braced core, okay? We'll go the same reps, 10 each side for that. If you need a little bit of a break, totally go for it too. Good. Looks great. That looks great. Two more each side. So that's one each side. Form looks great. Perfect. Go ahead and take a break. Awesome. How does that feel? Good. Is that tough at all?
Not too tough.
Not too tough. Okay. Well, that's not bad, but that's not. We do want it to be a little bit challenging. We'll keep it just the body weight for now. If it gets too easy, we might put some hand weights in or something like that. But we can kind of check up on that as we progress. I don't really want to go too far over 10 reps because obviously that was kind of a longer set, and I want it to be strength, not endurance. But you did great with that. We're gonna do one more thing, one more exercise. I'll have you stand up. I'll show it to you again. You've probably done this one, but it's gonna be a side plank. This is just to get all of that, again, core strengthening as a whole. So we're gonna be here, elbow down. See if I fit on this. And I want you to keep your hips back. So don't go into this. Keep your hips back, just like this. Okay, and we're gonna be holding that for time. We're gonna aim for a goal of 30 seconds. If you don't get to that 30 seconds today, that's totally fine. I just want you to do it for as long as you can. And if we hit that 30-second mark today, then we'll take a break and we can reach a higher goal next time, okay? So just remember to keep your hips back, chest up, head up, and we're gonna try 30 seconds each side, okay? Perfect. All right, let me get the timer for you. Okay, whenever you're ready. Perfect. Just keep that chest up, looking towards me. Good. Perfect, no worries. Okay, so we got the 15 there. Let's see if we can get 15 on the other side, okay? I'll let you know when we get there. How's the pain with that?
I'm comfortable. I'm not painful.
A little uncomfortable? Okay. We don't want to be pushing on anything we shouldn't, but we want to be safely strengthening that. Okay, whenever you're ready. Okay, that was 16 right there. Perfect. Great work. Awesome. I'll have you flip around. Okay. How's your pain level right now? Do you think that made it feel a little bit more painful, a little bit less? If it did, that's okay. I mean, we're strengthening it. We're not exactly, trying to dial down the pain there. We're just trying to work it so that it's actually healing long term. But how does it feel?
Not too much more pain.
Okay, good. Any less painful? Okay, that's totally fine. Perfect. Okay, I want you to walk out of here feeling a little bit better. So I'm going to have you lay face down. We're going to do some UPAs and CPAs, which is just that pressing motion that I was doing. And then we'll just go through that pretty light. Nothing, we're not going to be pressing too hard, but we'll get through that and hopefully it'll help to feel better, okay? How does that feel?
Good.
Good. Perfect. Fit all throughout that lumbar, especially on the left side. Okay, awesome. Well, we'll keep working through that. We'll do the same thing with your home exercise program that we just did with the treatment. I'd like you to just do all 3 of those at least once a day, okay? Awesome. We'll reconnect soon. Keep working with that. Awesome. Thank you. Okay.